In earlier videos, I talk about the pelvic floor structure and function. However, for this video, I'm going to go ahead and focus on the diaphragm. So the diaphragm is actually positioned up above the pelvic floor, and it runs parallel to the pelvic floor. So the diaphragm goes around our rib cage and actually has some attachments into our spine. When we take a nice inhale, you'll feel your ribs and chest expand. Particularly, this muscle really comes into play when I'm wanting patients to take nice, relaxed, slow breaths, or what's commonly referred to as diaphragmatic breathing. So when you take a nice, slow inhale, that diaphragm actually compresses down. It takes our internal organs, pushes them down, and then we'll see or feel the pelvic floor muscles expand. This lovely pistoning effect is the normal range of motion and integration that should occur with our deep breathing. The great thing about the diaphragm, though, is when we slow down our breath to about 6 breaths per minute, it triggers our brain to send out muscle relaxers and pain relievers. So when I give diaphragmatic breathing as a home exercise program, not only am I getting stretch and mobilization through that pelvic floor, I'm also working to down-regulate or calm down our central nervous system so we can get more into the rest and repose state of mind. So when you're practicing diaphragmatic breathing, what you want to feel is, yes, that nice chest and rib expansion, but I also want people to feel that gentle belly expansion, all with inhale. Then when you exhale, we should feel a nice, slow dropping of our spine, and our ribs and sternum will also drop in and together. So I oftentimes will tell patients, as you're doing and practicing this nice, slow, deep breathing, you can count in your head to about a 4 or 5 count on the inhale and about a 4 or 5 count on the exhale. So after this video is done, I think you should try that. The other thing that I like people to think about is when I'm inhaling, I'm maybe smelling a very beautiful flower, and then as I exhale, I'm blowing out as if I'm trying to make a candle flicker but not blow it out. So it's a very slow and controlled inhale and a very slow and controlled exhale. So this is lovely for getting that system down regulation and stretching through our pelvic floor muscles. So I love this as an exercise for maybe someone who has a very active mind like myself. Also, it's great for individuals who maybe have a tight, tender pelvic floor. If you have difficulty starting the flow of urine or having a bowel movement, starting this deep breathing ahead of time can really help our system down-regulate, relax, and function as it should. So practice it. Let me know if you have any concerns in the comments, and I look forward to you experiencing this lovely exercise.